I think a good place to start is what was USAID doing? Yeah, that we were spending all this money on. And so they're doing a bunch of different projects in a bunch of different places. In general, they are putting money into projects and places where it would not get put in by the government. But the nice thing about USAID is everything they do helps the US in some way. So part of that is through, and I'm a virologist talking, and so I am outside my comfort zone. But part of that is through a thing called soft power, where
Mhm.
it's like K-pop. People like K-pop everywhere. They just do. And because BTS are BTS, people feel a little bit better about Korea. It raises the esteem of the nation.
Right.
US was doing things. It was USAID was running projects to combat tsetse flies, which carry African sleeping sickness. They're
Hmm.
running projects that can both diagnose and help treat malaria, running projects to get rid of some of the insects that carry these things. They were running massive projects that would pass out antivirals and two great big vaccine studies on HIV that we pulled the plug on. Now, with funding agencies like this, there are cycles. They will fund a thing for 2 or 3 years, and during that time, you know you've got this much money to spend, and you're expected to meet all these thresholds and carry through. And if the person that gets the money doesn't do that, the money gets pulled, and we know whose fault that is. You know, you should have done better, or the
Right.
project didn't work out the way you thought. But what we're doing now is we're just arbitrarily stopping in the middle. And so this basically turns America from a country that is out there trying to do things that basically help other people in the world and also stop diseases in other countries before they come to America. We now become a nation that maybe isn't very good at keeping its promises. And yeah, that does not build goodwill, I have to imagine. Again, just a virologist talking here.
Hmm. Could you explain some examples of diseases that we need to stop before they come to America?
Sure. HIV is a great big bubbling cauldron of a disease because
Hmm.
once you get HIV, you can never be really cured of HIV. It's still in there somewhere. You can potentially suppress it with lots of antivirals, or some people will genetically suppress it at least part way, but they are still potentially infectious at some point, and it's taking years off of their lives. Now, HIV is going to be a virus that is going to spread once it gets over to other countries. We think this is how it started way back before we even knew what HIV was.
Hmm.
And so the more of it there is in the world and the more contact people have in the world, we're not going to stop planes and transnational commerce, just because there's HIV in the world. These are going to continue. And so the more there is over there, eventually the more there is everywhere.
And
Two vaccine trials that they were doing are really kind of neat. One was a vaccine to be given to people who are already infected. And the idea was that this might be able to build antibodies that can help protect them for longer and enable their bodies to fight HIV right where it is, which would very much limit their chances of spreading it to somebody else. So that's kind of cool. The other one was a different version of a vaccine project. That one's for people who haven't got HIV yet.
Mhm.
You could do these projects, and these projects are international projects. There are multiple American universities with American people behind these, in addition to some from the UK, some from the Netherlands. And these are things that this is good science. The reason why you would want to do science like this in a place like South Africa is that there's a very high incidence of HIV. People are going to come into contact with it, whether they like it or not, over there. So you have a chance to do some good and you have a chance to actually see if your vaccine works. If you were to vaccinate people of my age who are already married and not playing around, you are probably not going to be exposed to much HIV, and so you won't ever be able to figure out if your vaccine works. So you kind of have to partner with other countries in things like this. And it's not just like throwing money at those countries because we're throwing money, it's the government funding vaccine development. And If the government doesn't fund vaccine development, basically there are no vaccines,
Right,
unfortunately. Yeah.
absolutely. So just to clarify, this is not research that we can do independently here for the very reasons that you mentioned. We don't have the
Yeah.
significant population to be able to do the testing.
Or rather, if you wanted to do it here, you could go to somewhere. So cities are higher in HIV than the countryside in general, we think.
Mhm.
But it would take a long time because the incidence of HIV is so low, and you would have to prove that, 1,000 people would have been infected, but you have protected 700 of them, something like that. Statistically, that would just take you years and years and years. And these are problems that we need solutions to right now. I don't really want to wait years and years for an HIV vaccine because it could do so much good and make the world so much safer.
Mhm.
So safer in terms of infectious disease, and I think safer in terms of just sort of goodwill. Those are the
Right.
things that we were getting from USAID before the plug was pulled.
Yeah, absolutely. So have researchers essentially treated this as a temporary pause, or are they curtailing trials completely?
So some of these are multinational projects, and so there is some funding from other sources. I think they are scrambling to see if they can get somebody else to fund some of the good work that needs to be done. But yeah, the results vary. And if there is not an outside source of funding, there are some of these things. Big clinics that have just had to close and lock their doors and say, sorry, the US government doesn't care anymore. Yeah, we've got other priorities. And maybe so, but you're hurting so many people doing that and saving so little while you're hurting that many people. It seems like a bad cost benefit trade-off.
Well, the next big challenge that we're facing, as you and your colleagues have discussed, is avian flu. And given the fact that we're no longer monitoring avian flu in 49 countries, what does that look like for us
Well,
here in the US?
we'll know when it gets here, but we won't know when it's coming.
Yeah.
That's the thing. This is why we have satellite, weather radar, so that we can see the hurricane before it floods Houston or does whatever
Mm-hmm.
terrible thing it's going to do, destroys Puerto Rico again. Yeah. Being prepared gives you time to come up with some kind of vaccine and just figure out what you're going to do. If we had known COVID was coming, the US probably could have started producing masks instead of saying, oh, we'll just import those from China and everything will be okay. It's a little cheaper if we do that.
Yeah.
There are things like that that you can start to do if you can see these problems coming, and they take a while. And if we've turned off our early warning system, there will be no early warning. The tidal wave will hit, and we'll know when we're wet. There are projects up and down Central and South America. USAID was doing they're trying to eradicate malaria by more or less eradicating some of the mosquitoes that carry malaria. With USAID funding, I believe Paraguay and Argentina were both able to get rid of malaria completely, declare themselves malaria free. And then
Well,
several other countries are or were on the way to that. And malaria doesn't understand geopolitics. It's just a little parasite that lives in mosquitoes, and all it knows is making people sick and living in mosquitoes. When we take our foot off the gas on these programs, the malaria parasite spreads, viruses spread. They just spread like they were going to spread. They spread just like a fire spreads when there are things that can be burned. And if we're not fighting the fires, they're just going to burn and burn and burn.
mhm.
USAID was one of our big firefighting tools, in addition to being a major arm of international goodwill outreach. And we have yanked that arm back in or maybe cut it off, and that's a shame.
Wow. So, Dr. Neuman, skeptics would say that, an Ebola breakout in the DRC or Uganda doesn't really impact Americans, so why should we bother? How would you
Yeah.
respond to a statement like that?
Yeah, and look at the last Ebola outbreak. It didn't directly impact Americans for about a month. And then people were on planes. They came over to Texas. They came to other places, other
Mhm.
countries. And then all of a sudden, you have Ebola there. And yeah,
Yes, yes,
viruses don't understand international borders. And if it starts one place, the virus is going to replicate in humans. And so wherever humans go and wherever humans meet other humans, that is where the viruses and that's where some of these diseases are going to spread.
right.
And there are unique resources that you get in different places. Somebody in a different country may have a reagent or a plasmid or something that would make my project go or that we could work together on and move so much faster. All the big COVID vaccines were developed as international collaborations. None of those is just singly operated out of any country, and they work so much better for that. Having these companies and having these reagents in different places lets solutions be developed a little faster. Because if there's only one kettle where you make all the vaccine and it's in, I don't know, Wisconsin, that's fine. But you got to have trucks coming out of Wisconsin and going everywhere in the world. Whereas if you can have manufacturing stations in a bunch of different places or people working on problems in different places, it's just so much better. In science, our job is to read the current literature and know what everybody else is doing. And it's really frustrating knowing that other people are doing wonderful things that could make our jobs a lot easier, but we wouldn't have access to that potentially. So that's the risk of isolationism in science, I would say.
Where do you expect to see significant outbreaks of malaria, uh, famine,
Yeah.
malnutrition?
I would say it'll be in the places where it usually is, but worse,
Mhm.
because we'll no longer be delivering food aid. And so if you get a country that's in civil war or some kind of strife, there won't be any way to get the food in there. In terms of malaria, yeah, you would start to see it. The Plasmodium falciparum is the really bad one. You get a lot of that in Africa already. Chances are there'll be more of that because there won't be any sort of control. And with the bad kind of malaria, it becomes resistant. Usually it takes it a year or two to become resistant to one of the anti-malarials. Then you have to switch. You can switch over to the other one. If you're not monitoring, you don't know when you need to switch. And so you're just giving people pills that no longer work. And that
Mm.
is not where you want to be.
Yeah,
Not making
yeah.
anybody better. Yeah. But if there's a place there that can deliver the medication, that's fine. But unless they know what to deliver with the sort of command and control that the USAID projects were providing, there's not really a good way to know which pill to give when, or it's that much harder. Yeah,
Mhm. Like, so, Dr. Neuman, um, give us the big picture on what's happening here.
yeah. The US had a great outreach program, and I have to think that we touched a lot of people around the world through USAID. These are all projects that are dual benefit. So they're helping someone in another country, and they are directly or indirectly, in the short or long term, really helping here. And stopping those things right in the middle, just a screeching stop, is really bad press. It's really bad for science. There are ideas that may not ever get tested that could become vaccines for HIV. There are countries that could have been malaria free a year from now that may not be. There are people around the world that are going to suffer because of this. And when they do, they're going to think of the US, and they're not going to think of the US in terms of helping. They're going to think of the US as, oh, like, oh, you said you would help, and then you didn't keep your promise, and you decided to pull the rug out from under this. I mean, that's your priority, but oh, yeah, you wish it wouldn't happen.
Yeah. And what would you say about countries being able to do this for themselves without funding from USAID? Do they have the capacity?
Some do, some don't. And in general, the ones that do are also contributing to the WHO, and they generally don't have these sorts of problems. The
Mhm.
problems tend to creep up in countries that are still developing. Take a Burkina Faso, the road network is not great. Running water is not available everywhere. I'm making it sound possibly worse than it is in a lot of parts of the country, but they have bigger problems. And developing the next generation of HIV vaccine is not, there are so many big problems there already that I don't see how they would get to that point, let alone have the sort of infrastructure that can produce nanoparticles with a particular recombinant protein on them in enough quantity to be able to put into people to be able to make this thing work. There are some things that we can do here that just can't be done elsewhere without millions and millions of dollars of investment that just isn't likely to come.